From the moment you walk in through the door, you will sense that this is not your everyday ordinary medical practice. In every corner of our facility, you will see our #1 value reflected, that prevention is better than cure. So join me as we tour the multifaceted facility and meet the staff who keep the heartbeat of our practice strong.
Welcome to Cardiovascular Interventions, Central Florida's premier cardiology practice. We're located at 1900 North Mills Avenue in beautiful Lake Helen in Orlando. Our 12,000 square foot facility houses the most technologically advanced collection of modalities to help make your visit to CVI a comprehensive one. As if that's not enough, Florida Hospital, which is the world's busiest cardiac care facility, is just steps away. Here at Cardiovascular Interventions, we believe prevention is better than cure. Our warm and personable staff is dedicated to instilling confidence and support as you transition to a more heart-healthy lifestyle.
Healthy Image is an extension of our practice. It is our way of helping people who have no insurance or do not have prevention as part of their existing health plan. By empowering people with knowledge of the existing health, we hope to be a source of continuing education and inspiration to better life and better health. We also help companies protect their most important asset, the employees. By coordinating health fairs, a company can exert more control over the employees' health and thereby reduce healthcare costs, reduce absenteeism, improve morale and productivity. Healthy Image is our way of connecting with the community of Central Florida. We want to get people back onto the road to good health.
At Cardiovascular Interventions, we realize that patients can't always come to our location. So we've instituted Healthy Image, a state-of-the-art 35-foot state-certified mobile clinical laboratory. We can't emphasize how much prevention is better than cure. This mobile state-of-the-art facility screens for hypertension, diabetes, stroke risks, peripheral vascular disease, aortic aneurysms, carotid artery, cholesterol, good and bad, blood oxygen saturation, bone density assessment, and more, up to 14 tests in just 30 minutes.
EECP is a non-invasive treatment for patients who have angina or chest pain. Angina, of course, is the chest pain that patients experience when they have blockages in their coronary arteries. EECP is safe and effective and has no significant side effect. EECP has been available in my practice since 1994. I embrace this technology because it's non-invasive and it's safe and it is effective. Of course, the alternative would be angioplasty, bypass surgery, or stent placement. But EECP not only improves angina, but the patients also improve psychologically and emotionally. But it also improves the quality of life. There's less chest pain, emotional benefit, and the same benefit one would get from receiving angioplasty. Sleep disorders are very common. In fact, up to 25% of the population have some sort of a sleep disorder. But in cardiac patients, it's even more pertinent because a sleep disorder can increase your risk of heart attacks, strokes, congestive heart failure, and arrhythmias. At Cardiovascular Interventions about 3 years ago, we designed our sleep center so that we can study you in this high-tech environment, yet a homely environment. Our sleep lab utilizes the leading-edge technology in the diagnosis and management of sleep disorders. The improvements are not only medical, but also the quality of life improvements are tremendous. Our sleep lab has comfortable beds, cable television, warm colors, with all the comforts of home. Now, the treatment of sleep disorders has changed a lot in the last 10 years. And most patients accrue so much benefit from the treatment of their sleep disorder that it helps them from the cardiac standpoint, but also their quality of life. There's tremendous improvements. Most patients come back and thank us over and over again.
I was complaining of fatigue. I was tired a lot, and it's just non-existent anymore. It's really changed both of our lives. So I want to thank Dr. Jamnadas for doing it too. I mean, everything that they've done has been great.
Part of our commitment to excellence in health is to provide comprehensive classes in our office and on the road on various aspects of lifestyle changes, free to the public, patients, family, and friends. Some of our workshops include nutrition classes with hands-on demonstration in our cooking kitchen, where practical information and demonstrations are carried out to show you how you can implement these changes into your life. Some of these topics include stress management, weight management, and exercise. Practical information to implement into your life today to not only improve your health, but also to improve quality of life.
During the course of the month, our Teaching Kitchen features our on-staff nutritionist who's also a gourmet cook. Her name is Roxana. She'll get you on the way to heart-healthy living by teaching you heart-healthy recipes that are both nutritious and delicious. And what can be better than that? How about a cookbook from our very own Dr. Jamnadas featuring some heart-healthy recipes that he talks to you about during your patient visit? To find out when Roxana will be teaching our next heart-healthy recipe class, simply ask our receptionist.
Tremendous strides have been made recently in angioplasty and in the treatment of coronary artery disease. I've been performing these procedures for about 15 years. But more important than that, it's who you do it on and when you do it. Well, we're going to get started and see if there's any blockages in your arteries of your aorta. And I'll give you a little bit of Novocaine. You shouldn't feel much discomfort at all. And in a few minutes, we'll get started and you'll feel a heart feeling, okay? So here it comes. Feel a little bit of discomfort. Shouldn't be much discomfort at all. There you go. We're going to see the arteries, and hopefully this shouldn't take too long. We'll put a little stent in there. And there it goes. Looking really nice. That stent here is looking nice. We have beautiful, beautiful... Case selection is most important. So my judgment and background experience, combined with the lifestyle changes that we are advocating, we hope to not only modify the disease process now, but for the future also. Put the stent inside now. We're going to inflate the stent. Here it comes. Looking good. Wonderful. This is really nice. We're getting a very good result. Excellent. But I think this is going to wrap it up. Looks good. Thank you. Our nuclear lab at Cardiovascular Interventions has the state-of-the-art dual-head system, which gives the most accurate nuclear stress tests. Now the question is, why are they necessary? They're necessary because not every blockage needs an angioplasty or bypass. Based on the results of the nuclear stress tests, we can pick out the patients who really need an angioplasty or who really need bypass surgery, or we can follow the progress of a patient. High-quality nuclear stress tests are an integral part of the management of patients with heart disease. The results of a high-quality nuclear stress tests allows me to design a medical program specific for the patient, combined with the lifestyle modification program of the kind that we offer at Cardiovascular Interventions. And together, we can not only improve the medical prognosis, but improve the quality of life too.
As you can see, this is our dual-head GE Millennium myocyte. It's one of the latest and greatest state-of-the-art machines here in Central Florida. And Dr. Jamnadas is very privileged having this type of machine.
As part of our commitment to health excellence, we developed a cardiac rehab program for our cardiac patients 14 years ago. Now, cardiac rehab is so important because it reduces the possibility of readmission to the hospital, future heart attacks by 25%. Not only do you improve medically, but there's quality of life improvements also. Our cardiac rehab program has two phases. Phase 2 is for patients with existing heart disease, and it's a 6 to 12-week course. And this course is given by certified exercise physiologists.
Phase 3 is a more independent program where you're more in charge of your exercise and you keep track of your exercises yourself. If you have any questions about our program, our receptionist will be glad to answer any questions, or myself, so please give us a call.
With this information, they can go home and continue this program so that they can continue to accrue the benefit physically, mentally, psychologically, and the quality of life improves always. One of the breakthrough technologies in the last 5 years are pacemakers and implanted devices. Now these include ICDs, which are implantable defibrillators, pacemakers, and biventricular pacemakers. Now, of course, these are implanted in the hospital. But once implanted, they need follow-up in the office. Close adjustments are made to the devices as we interrogate them in our pacemaker clinic. And through the magnet, we're able to adjust your device to work at maximum efficiency. And of course, you want the battery to last a very long time. Some of our patients have the convenience of trans-telephonic checks from home. They only need to come into the office once a year for checkup. Our pacemaker clinic has the highest, technologically most advanced computers to monitor these devices and follow the patients closely. My approach to a healthy cardiac diet is a very down-to-earth, sensible diet. What this means is looking to see what kind of a medical system do I have to digest food. Now, if you think about it, our genes have not changed in the last 100,000 years. Yet the type of food that we are consuming today is so different from the food that our grandparents ate. So my approach is to try to replicate the type of diet that we should be eating based on our genetic makeup. Going back to nature, eating the way our body was supposed to eat, avoiding things that are prepackaged and processed. And I always tell my patients this joke that, look, when you go out to the farms, you don't see packages growing on trees, you don't see boxes on bushes, and we don't see soda streams. So we want to get back to basics, eating foods that are given to us by nature, fresh foods, fresh water. This is what our body requires for nutrition, not the processed foods of convenience that we have today. We will show you how to make a practical approach to this. We advocate at least half an hour of vigorous activity every day for everyone. Now, sometimes some patients can't do that much exercise. Then we give them a special program that suits them. But they must exercise. Some form of exercise is extremely important. It's not only important for them physically, but it has great mental benefits as well, and stress management. So it all rolls in. You've got to look at the whole picture. It's not just your body, it's your whole lifestyle, from thinking to acting to feeling and behaving.
And my heart attack was December 9th, 1989, and I was unconscious for 15 minutes, and at the end of the 15 minutes, he grabbed my hand and he said, "You're going to be all right," and energy passed from his hand to my hand. That's called spiritual healing, and he's a fantastic, wonderful man.
It's the whole thing. It's how you think, it's how you feel, it's how you behave, it's how you walk, it's how you exercise. It's the whole thing that's going to affect your health. We believe in this type of a holistic approach, high-tech with complete lifestyle management.
If you haven't already heard, Central Florida is the heart capital of the United States. You've got a plethora of choices for cardiovascular care. We're grateful that you've chosen Cardiovascular Interventions and Dr. Pradip Jamnadas. Here at Cardiovascular Interventions, we're passionate about our work because we're passionate about life. So therefore, we're passionate about you.